You're listening to Jonesy's Jukebox on KLOS. The time is 4 minutes after 12 bells. It's nice and cool out. I'm absolutely knackered. I didn't get to bed till like 3 o'clock last night and went and saw Iggy Pop, which was a great show. We'll talk about that later. But right now, we've got a guest in, Dr. Sheila Nazarian.
Hello there.
Did I say it right?
You did.
Nazarian.
Yep.
Fantastic. How are you?
I'm great. How are you?
I'm all right.
I hear you got some concerns.
I do. I do. I need a knob reduction.
You do.
Just kidding. I've got a big tattoo here.
Yes.
That I want to get rid of.
Let's do it.
Now, how do you do it?
So basically you come in, we take some pictures of it.
Yeah.
I'll inject you with some lidocaine so you don't feel the actual laser working because it's not pleasant. And, we laser it. We put some aloe on there. You go home. It might blister a little bit, might scab a little bit. Come back 6 weeks later and we hit it again.
6 weeks later?
Mm-hmm.
So what's different this way than the old way of lasering?
So the old way of lasers was a shorter pulse. It was, a nano pulse. This one's a pico pulse. So what it does is it changes the way that light energy from the laser works. When it's a nano with the old lasers, it was burning a hole through the pigment, through the cells that were tattooed. This way, it's sort of like exploding those cells, and then you have janitor cells floating in your body, cleaning up your dead cells from your heart and your kidney all the time. It takes advantage of your janitor cells. They just come in, they're like, oh, damaged tattoo cells, and they clear it, and you poop them out.
Delightful. And there's a picture of the tattoo on the number 2?
That would be interesting,
Is there going to be a skull on the number 2?
That would be awesome. We would definitely put that on the website if it were that way.
We should film that.
We should.
You should put that on your website.
Yeah.
You can actually film me doing it.
Let's do it.
Doing number 2. and see what happens.
Okay.
What do you think?
Whatever you're comfortable with.
Okay, moving along. This thing.
Yes.
This thing that I've got that's called a neck.
Yes.
Looks like a polo sweater.
It does. A turtleneck.
Yeah, exactly.
Yes.
A turtle.
I like the way you say turtle.
Turtle?
Yeah. It's awesome.
I like the way you say hello, because that's how I say hello when I'm greeting people.
You do.
You said hello.
Hello.
That means aloe, right? Aloe vera.
Aloe vera.
Yeah.
Yes, now I know what you mean. So yeah, your neck needs a knife.
See, this is so... See,
I meant that in the most non-violent way possible.
Yeah. I was thinking that was some new thing that you could do, though, where you do the freezing thing. What's that?
So the fat freezing is cool sculpting, and they just, recently came out with an applicator that treats fat on the neck. Unfortunately, with you, it's not so much fat that you have as it is loose skin. So with the amount of loose skin that you have going on there, we need to pull it back and excise it with a neck lift.
So this has got nothing to do with me being overweight.
Well,
it's genetic. My mum has
actually,
this.
let me tell you. Actually, they've done twin studies where they look at twins, and they decide what makes one look older than the other. Identical twins.
Yeah.
So smoking, the twin that smokes looks older, right?
Yeah.
The twin that's fatter looks younger.
Right. Because he ain't haggard looking.
It's not haggard and hanging and loose. So actually being a little bit overweight is keeping you young looking right now. If you were to lose 20, 30, 40 pounds, your face would drop more.
Well, that's terrible news.
So if you're planning on losing weight, then definitely pencil in a facelift.
Oh, man.
Yeah.
I thought, okay, I can't win here. Lose weight.
Yeah.
I'm going to look knackered. Okay.
Well, we had a bride come in and she was trying to lose weight for her wedding.
Yeah.
But she had about 50 pounds to go too. I told her, you got to, work on putting away some money for fillers in your face because it'll drop. Once you get to a certain age, the skin doesn't bounce back.
I have good elasticity.
You do?
Can't you tell? Do you want to feel it?
I did.
My arm.
No, your arm's good. We're talking about your neck though.
But it's not. It's kind of. There's some people like fair-headed people.
Yes.
Don't have a lot of elasticity.
You're right. That's
See?
definitely true.
And I'm always like tan, and I don't even lie out anymore. I've been living here for so long.
Yeah. It's like burned in.
I have a little bit of Spanish in me.
You do?
I did the old, what's that thing? Ancestry.com.
Oh, you did?
Yeah.
That's so interesting.
And it came back, and I thought I was just an English bloke.
Right.
You know, but it came back, I have 28% Irish.
Mm-hmm.
Some Scandinavian, something in there, and then there's some weird place, some place in Spain.
What motivated you to do that?
This friend of mine made me want to do it, and I thought, okay, I just got to put some saliva in that, and then she did the rest. I was curious.
Awesome. I know. I think I'm curious too.
I think everyone would be surprised.
Yeah.
You know.
Yeah.
I don't know if it's really accurate. I mean, I don't know.
You'll never know.
You won't, right? It could be all nonsense.
Totally
just say he's 28% Irish. Just whatever. Change it around. Pick a number. How do you know?
Well, they didn't. Well, I guess it must be accurate a little bit because they didn't ask you what your skin color was. You don't have to submit a photo when you send it in. You just send in your saliva, right?
I guess so. Yeah.
Yeah. So.
Yeah, I guess so.
Yeah.
Maybe they have the same thing for everyone. 28% Irish. Blah 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 blah. Okay, so how big's this machine? Do I have to come to you?
You do. It's a tank. It literally is a tank. I can barely push it. I have to go work out.
Okay.
Yeah.
So, like I said, I had one removed before, and it was pretty big. Mm-hmm. And I did that in four sessions because I went over it. I didn't want it completely gone. I didn't need it completely gone.
Right.
And but that was every 2 weeks.
Really?
Yeah.
Because usually the other lasers, they make you come back months. Yeah.
But I mean the gap. You're saying I see you once and then I got to wait 6 weeks.
Right. Usually the gap from the old lasers is months. So I'm surprised they did it every 2 weeks.
Yeah.
Yeah.
So.
We'll see how you do.
Yeah.
Yeah.
What if I don't get lidocaine? Because I didn't for this. It killed me, but.
You don't have to. It's just will kill you. Are you into that?
I'm not into that. I don't mind dishing it out. I don't like taking it.
We have that in common.
But really. So as far as pain,
yes,
is it about the same as the old way?
Yeah, I would say maybe a little bit less, but still, it's not pleasant.
No, I know.
Yeah.
So that one, you'd be done in 30 seconds, a minute, right?
Yeah.
Yes. So that's the good news.
Yeah, no,
even though
quick.
it's like you're being knifed a million times by Psycho, at least it's quick.
It is quick, but my whole philosophy with surgery or with procedures is if it doesn't have to be painful, why should it be? So.
What is the stuff you're going to inject in?
Lidocaine, just like when you go to the dentist's office.
Yeah. Now I'm a sober person. Mm-hmm. It ain't gonna get some weird stuff in my system and make me.
No, it's no.
Or weird. I have to ask because a lot of people don't care.
No.
You know what I mean?
It won't make you. I don't know what you mean by weird. It won't make you weird.
Well, whatever the stuff is it gonna make alter my thinking?
It's a stimulant.
No,
right?
no, not at all. It's a local anesthetic.
It's not like cocaine.
No, it's not for pain. It doesn't treat pain; it prevents it.
Can you give me cocaine when you do it? And some amyl nitrate.
Oh my God! It's funny. Do you ever watch The Nick? I think it's on Showtime.
The old one? No, that's not the one that was.
It's a new show, but basically they used to give cocaine as an anesthetic. That was a while ago.
You used to get cocaine in Coca-Cola.
I know. And then they replaced cocaine because they realized it was addicting. So they say, we have a great drug to get you off the cocaine. It's called heroin.
Yeah.
It's a great show.
Yeah, I did that heroin for a while. I don't suggest it.
Yeah.
It's not that good. It's a great feeling, but coming off it is not good.
I'm a nerd.
Yeah.
I would not know.
Good.
I've been in a library for 30 years.
Where's your office?
Wilshire and Lapeer, so in Beverly Hills. Between Doheny and Robertson on Wilshire.
So when are we going to get started?
Whenever you want.
Now let's go to the neck.
Okay.
What does that entail?
So it's
put out.
Yeah.
I have to have what do they call it?
Anesthesia.
Anesthesia.
Yes, that would be ideal.
And then what happens?
And then
are you the one who's going to cut me open?
Yeah, that's my job.
So go on and
It's
just
weird,
tell
but
me.
it's my job. So yeah, we make an incision in front of your ear.
In front, a little thing.
No, it's from your hairline, and then it goes all the way to the bottom of your earlobe, and then behind your ear in the crease.
Yeah.
And then into your hairline a little bit in the back. And we basically dissect the skin off your muscle, tighten up the muscle, and then whatever amount of skin easily comes out, cut that out, sew you up.
So is this going to look like a facelift or
It is a facelift.
Oh, no.
Facelift and a neck lift are very similar.
So it's going to look, I'm going to look like one of them blokes who's had a facelift.
No.
If I go through it. I can't do that.
No, I would never do that to you because that would just be poor advertising for
Like
me.
Burt Reynolds or someone.
No. I think with men, you have to be very conservative in what you do or else you feminize them and they look done.
Yeah.
Yeah.
I don't know. I might have to think about that.
Totally okay.
Maybe I'll just wear a sweater. Type polar neck sweater.
You can do that too.
Yeah.
Much less downtime.
So once you're doing that, and
Yeah.
I'm out, obviously I don't know what's going on. I
Right.
wake up, it's done.
Yes.
How long are you doing that for? An hour?
No. It can be anywhere from 4 to 6 hours.
Oh, man.
But it doesn't matter how long you're out as long as it's under 6 hours. It's kind of like going in an airplane. You know, the dangerous parts are when you get off the ground and when you land.
Yeah.
It doesn't matter how long you're really in the air.
Oh, man. We got to talk about it. Let's start with the tattoo first.
Let's do that.
Let's see what happens. I really appreciate you coming by.
My pleasure.
Do you want to promote yourself?
Sure.
Go on in.
It's Nazarian Plastic Surgery in Beverly Hills. I'm a board-certified plastic surgeon. Also a mom of 3. Happy Mother's Day to you all out there. And on Instagram, it's Dr. Sheila Nazarian. I have a great Instagram. Follow me.
So do you have pictures of your work on Instagram?
I do. And actually, we have videos of surgeries on my Instagram as well, whatever, is within Instagram guidelines. But yeah,
I should have a look.
you should. It's totally fun.
You should have a look at my Instagram too.
I will.
If you want to have a laugh.
Okay.
Well, thanks for coming by, love.
My pleasure. Anytime. And I'll see you soon.
Next week,
Yes.
someday next week.
Let's do it.
I got to get it started.
Let's do it.
Let's play Doctor. You said your name. Let's say it again. I'll say it. Dr. Sheila Nazarian
Perfect.
is the.
It sounds better when you say it, Jonesy.
It does. let's play a song. Let's play the Who. Guess what this song's called?
What is it called?
Tattoo.
Perfect.
Jonesy's Jukebox. KLOS, take it away.